Thank you very much, Professor Sabri. With this, I would now like to invite Dr. Umair Rashid. He is head of Punjab Institute of Neurosciences, LGH Lahore, and he has the honor of making the first stroke center of Pakistan, and that was the first workshop I attended in Lahore with him. So we are honored to have you here, sir. And he's going to give you an account of what is the basic intracranial neuroanatomy that you need for thrombectomies.
Assalamu alaikum. Thank you very much, and Dr. Hassan. When he sent me a message, I have to talk on anatomy. So I thought, how he know that I got a supply in anatomy when I was in medical college. So he thought I might have studied more for this. So I tried to get few slides, and believe me, this is one of the very few presentation where I really worked hard to make it simple, because anatomy is relatively quite dry. Everyone is very difficult. When you hear this topic is coming, you said maybe who will attend or who will go after this presentation and will be seated and listen, Adnan Siddiqui and Roy and Saubri and others. So, but I feel this is very important. In fact, the first slide is not coming up. Yeah, this one. Okay, from here. So, as you know, intracranial anatomy and what you really need to know for stroke intervention is very difficult, but it's very important. In fact, as long as you're not clear about the anatomy or embryology as well, I always tell my juniors, my fellows, my colleagues, you should be good in anatomy and embryology. You can understand the philosophy of vessels and the natural history of the disease. Without this, you can't be clear. Something, I show you my few slides. Maybe it's new for you, but they are very important. It gives you a actual spectrum of how to play with these vessels. Excuse me, yeah. Okay, could you stand here? Embryology of the carotid system. These two words should be in your mind: ventral aorta and dorsal aorta, and they are anastomosed with the aortic arch. Usually there are three aortic arch. You could see on the picture, first, second, and third. And the dorsal aorta is very important for us, which develop into the internal carotid artery. So as there are just few points, but these are very few points which will be important when you play with the carotids and with the brain. Third arch, precursor for common carotid artery and internal carotid artery. It's just along the third arch. Carotid bulb and proximal segment. So far, generally, very few people use the zero segment, which is the most important when you do the carotid stenting. And this is the most frequently involved segment of cervical segment of internal carotid artery. And its development is totally different from the remaining cervical carotid. So that's why sometime embryologically may belongs to ascending pharyngeal artery. So baroreceptor can be present in the ascending pharyngeal artery. When we try to embolize sometime in the pre-surgical embolization, we have to be very careful for the ascending pharyngeal artery, because you get the same receptors which you could find in the carotid bulb and along the zero segment. Rest of IC is found by cranial portion of dorsal aorta. So far, carotid bulb and proximal segment, which is called zero segment, embryologically they are different. They will behave totally different. When you cross this, then we have, as I've mentioned before, it's a dorsal aorta which develop into the internal carotid artery, and they are 7 segments. These 7 segments are very important. And the next slide, it could be very simple but very important for you, and these are boundaried by embryogenic vessels. So in embryogenic vessel, you don't have to know about which vessel, this and that, but you should know these are some vessels. If they remain there and one segment is absent, you can get a supply from those routes, which you will see in the next slides as well. So these are the segments. Beautiful picture by Louis Ajanis, who was a French guy who was my teacher, and I attended his course back in 2000. So these segments are very, totally explain where this internal carotid is coming up, and if one segment is absent, so from where one can get a supply. So as I mentioned earlier, common carotid originate from internal carotid artery, and the ventral segment, which is ventral arch, ventral aorta, which is regresses and form into ascending pharyngeal and form into external carotid artery. So just make it simple, dorsal and ventral. Dorsal goes to the internal carotid artery, and ventral remnants form the external carotid artery. So these segments, after the embryological life, you get these segments. Cervical segment, 0 segment, I have already explained, slightly embryologically different. And then when you play with this vessel, you have to be careful where are you playing. Preter segment is very important because the maximum anastomosis are here, extensive anastomosis. So sometime if something is happening and you couldn't see the vessel, if you can get a supply from the side, it's not a strange because there are the anastomosis here around it. And corner segment is usually extradural. Extradural, I mean the boundary along the ophthalmic artery. So cerebral segment, which is the above this, in which the division takes place. So these segments is just to recall, to remember, when you go into the internal carotid, you have to look for these segments. And before that, 7 segments should be in your mind. At least if one segment is missing, you could say one can get a supply from there. So this is my very interesting slide. In fact, generally, the people don't go into that detail. ICA may be absent. I always say one can live without ICA, one can't live without external carotid artery. This is very important. So sometimes you see totally occluded ICA and the very well-established collateral. We are not supposed to play with this internal carotid artery. You could see here. I mean, and secondly, if they are anastomotic channels, if you remember something, so you could get a supply from the other regions. So one can't live without external carotid artery. So this is very prerequisites when you play with the stroke patients. You should be knowing all these. That's why some people does CTA. There's some believe in leptomeningeal vessels, which will see you in the other slides, and the Roy will tell you how to look for these things as well. This is my favorite slide. And believe me, if you able to get this slide in your mind, most of the things will be clear. As I told you, 7 segments of internal carotid artery, and the last segment divided into anterior division and posterior division. This is very important. And from anterior division, the first artery to be developed is anterior cerebral artery. And from anterior cerebral artery, you get anterior choroidal artery. From anterior cerebral artery, you get the ventral ophthalmic artery, or the ophthalmic developed after originating from one side and from the anterior cerebral artery, and then later join the carotid artery. Very interesting phenomena. It's just like a game. And the last artery, I always, the guy coming for the training, I say, from MCAs originate from where? He said, it's a continuation for internal carotid artery. I think it's wrong, which we are read, the same thing. It is the segment originating from anterior cerebral artery. आपने भी पढ़ा होगा कि sometimes you get the term excessive middle cerebral artery. So it's not excessive middle cerebral artery, it's another twig, persistent twig coming from anterior cerebral artery. So this is about anterior cerebral artery, simple. For the posterior division, you get posterior communicating, and most of the time, posterior cerebral artery originate from internal carotid artery from the posterior division. About 2 to 3% is from the anterior choroidal. It's very interesting. And less than 2% is joined with the basilar artery. So this slide tell you MCA is not a continuation of internal carotid artery. It's a branch of intercerebral artery. So you should be knowing it. I mean, if you see something like this, you could see the intercerebral artery and the many tricks are coming towards the MCA, you can realize, so this is the same thing which is happening. And secondly, if you couldn't see anterior choroidal artery from here, you could get from the posterior choroidal artery. So one should be in your mind, these vessels are there. As already mentioned, there's very rarely two posterior cerebral artery coming from basal trunk. So this is a slide which has to be remembered when you do posterior circulation. It's a another interesting. It's nothing to do with the dorsal aorta. It's nothing to do with the internal carotid. It's yes, it is partly connected with the embryological vessels, but basically the basal artery fuses together. It's a neural plexus. So it's when fused, it becomes basal artery. So in our practice, when it's abnormally fused, you can get an aneurysm. So it's not the topics of the day, but one should knowing how the neural plexus fuse and the basal artery comes up. Cerebral artery, these expands with the expansion supply. Basically, you have heard three arteries in the cerebellum, which during your stroke patient, inferior cerebral artery, anterior cerebellar artery, posterior cerebellar artery. The only inferior cerebellar or anterior inferior cerebellar artery, these are metameric vessels. They are the peripheral nervous system, nothing to do with the brain. The only superior cerebral artery that goes with the brain. So that sort of a thing, just take 2 minutes. So this is, and sometime if you don't get it from the already the developed arteries, you get a precavernous position of the ICA as a persistent trigeminal artery. So these are the connections you could see here. One is there's the posterior communicating artery because the injection is in the vertebral artery, and from vertebral artery you could see the internal carotid is outlined, and the other is trigeminal artery. These are very frequently seen. So these are the few interconnections which should be in your mind. PCOM, trigeminal, hypoglossal, which regresses from ascending pharyngeal, external carotid, ICA, proatlantal, segmental, again metameric vessels joined with the vertebral artery. MCA, just two slides. Okay. MCA, which we are playing most of, because generally now say that these are more frequently involved in the stroke patients. So it has two segments, horizontal segment, usually we play with the horizontal segment. The other is vertical segment. It's a different classification. One is insular, operculum, and otherwise superior, middle, inferior. Because superior, middle, inferior trunk should be in your mind. When you are looking on the angiogram on CTA, you could see some vessel, yeah, it's okay, MC is discernible, so no need for going thrombectomy. But you have to go into that detail. Superior trunk, frontal lobe, middle trunk, which go into the central sulcus, inferior trunk in the temporal lobe. So you could see on if it's in your mind, I have to see all three trunks and they are discernible, you can play with it. So it's very important. Collaterals, this is very important, and I was just looking on the program. There are so many presentations related to it. Leptomeningeal, most important. I'll show you just last slide next to it. Anterior communicating, which you're already knowing it. Posterior communicating, you are already knowing it. Another artery, which we are not knowing that much, is the most important artery, middle meningeal artery. It's not one artery, it's a system of different vessels originating from occipital, originating from getting it from the ophthalmic artery, or actually in the life, it's originating from the maxillary artery. So this is the artery which become like a picture on a frontal projection at a pseudo middle cerebral artery. So all these are vessels are very important. So this is maybe my last slide. Leptomeningeal Collectors or circulation is a network of blood vessels supplying the brain that follows a diffuse course over the superficial surface of the brain. This circulation is in the leptomeninges, the two deeper layers of the meninges, and the peel mater and the arachnoid. So leptomeningeal word should be in your mind. You could see this picture just 4 days back, and the guy came to me, the family guy, कि sir, our father had ischemia और ये CT ये हुआ था जी, तो मैंने कहा कब हुआ यार, ये तो इसमें आ रहा है ब्लॉक है ये वो फला. So उन्होंने कहा जी ये 3 दिन हो गए. And then I look into the grossly, you could see their vessels are here. These are the leptomeninges. I said, how's your father? He was sitting next to us, just next to us. You absolutely normal, believe me, absolutely. Or here, on this picture, we will say it's a disaster. We have to go into the MCA, this and that. So if you are clear about the collateral supplies and all this, we can save the patient without treating them. So this is a wonderful example where MCA is blocked at the mid of horizontal segment. Otherwise, there is a good collateral supply and patient is absolutely normal. And this was on the left side. Thank you very much.